In this segment, POPPYN producers explore the practice of art therapy and its benefits. We sat down with Danetta Watson, an art therapist working with youth. We also spoke to a POPPYN producer who tells their story on how art therapy impacted their life. What is art therapy, or how would you define it?
What we're actually doing is helping people to bring out what's going on internally, whether that's their thoughts, experiences, and putting it into an external form, which is the art object, and then processing it, and around that dialogue, reincorporating what came out of that. So it's a dual dance between the internal versus the external, and the art making is that product.
Art therapy is a way to better connect with yourself through any kind of art form, and it's also a way to express yourself in a way that doesn't involve any conventional kind of thinking.
Art comes in many forms. What do you offer for your clients?
So I may offer drawing just with color pencils and markers. We may use painting, so different types of paints, whether that's watercolor, acrylic, or oil. We might do some sculpting, like using clay or some form of like model magic.
I'd say an average session of art therapy is really up to you. Like, you can spend all of your time doing one thing, or you can jump around and do a bunch of different things, and you can start a project or finish one, or just you do you. That's really all it is.
What is the difference between art therapy and traditional therapy, and are the results different?
Non-traditional therapies typically sometimes are referred to as like talk therapies. So meaning that the primary mode of communication, like within that session, regardless of the modality, is talking. And then the main difference between that and with art therapy is that within art, the primary mode of communication is the art making and the creative process.
For me, I think that the deconstructed nature of art therapy is what allows you to express yourself. It's a breakaway from your daily life in order to come into one's own.
What is the most common thing you see among youth when they come for help for you?
It's very generalized, but overall I would say, the majority of the youth that I work with come in with anxiety-related issues or depression or some trauma, grief, or loss.
When I first started doing art therapy, I was in Belmont's mental hospital, and that was not a fun time for me. Doing art therapy while I was in there allowed me to not escape the situation that got me in there, but escape being there and more being in the hospital and understand the situation that brought me there better.
For me, being in a private practice setting, what I really notice with clients is just their ability to express themselves maybe more fully and more clearly after you're kind of maybe working your brain to think differently. So when you're creating artwork and you're putting your internal thoughts and feelings and experiences into an art product, it kind of shifts your mind a little bit, your perspective on how you view situations.
Art therapy has grounded me a little bit more. I've come to terms with a lot of feelings that I wouldn't have originally. It just helps me better connect with the present moment and myself. For
a youth who is too afraid to go to art therapy and will be open to do it at home, what do you recommend for them to do?
I would always encourage people to talk to the people around them, talk to their families, and if you feel like it's kind of elevated to more a higher need and that maybe you're not able to get the support from whoever is in your support unit, then maybe therapy might be an option.
If you're scared of getting help, that's okay. You have to face your fears in order to overcome certain things. But if you want to do something for yourself, by yourself, you can do art therapy.